करेंगे रोल ऑफ द नर्स। फर्स्ट रोल जो होता है कोऑर्डिनेटर, सेकंड इज अ कम्युनिकेटर, थर्ड इज अ टीचर, फोर्थ इज अ काउंसलर, फिफ्थ इज अ मैनेजर, सिक्स इज अ लीडर, सेवंथ इज अ टीम प्लेयर, नेक्स्ट इज अ मोटिवेटर, नेक्स्ट इज अ डेलीगेटर, critical thinker, innovator, researcher, advocate. Coordinator coordinates and plan care, pieces together fragment care, prepares patient for discharge, liaison in a healthcare team. Communicator establish the rapport, establish the therapeutic helping relationship, be aware of verbal and non-verbal communication, assertive communication. Teacher educate the patient to develop the self-care abilities, provide knowledge to allow the patient make information decision demonstration needed skill, promote the health, prevent the illness, restore the health, facilitate the coping. Teacher learning process, teaching planned method to help the someone learn. Learning is a process by which an individual increase their knowledge or change their behavior as a result of an experience. Learning domain, cognitive learning, acquiring new knowledge, psychomotor learning, acquiring a new physical skill, affective learning, acquiring changes, values, feeling, attitudes. Developmental and consideration, children learn through play and experience, take into account their motor development along with their intellectual development. Adolescents learn their through their peers, take into account their intellectual developmental maturity and psychosocial development. Developmental considers andrology. Adults must believe they need to learn before they are willing to learn. Adults bring the life experience as resource of learning. Adults believe learning should be useful immediately rather than in future. They want relevance. Adult internally motivated and capable of self-regulation. Developmental consideration assess the perceptual impairment, visual, auditory, memory, longer reaction time, and also generational learning differences. Learning lifestyle, visual, auditory, tactile, combination, concrete versus abstract, active versus reflective, right versus left brain, multiple intelligence, verbal, logical, visual, body, musical, inter and interpersonal. Principle of teaching learning communication is important. Through assessment, the patient learning needs and factor affecting their learning, including patient in a planning, use varied teacher strategies, utilize patient previous life experience, utilize nursing process, barrier to learns, language, cognitive level, lack of interest, cultural differences, literacy, health and stress. Utilizing nursing process assessment, ready to learn, ability to learn to strength, what do they know already, do they want to learn, analysis, knowledge deficit planning, who, what, when, where, how determines the whether cognitive, psychomotor and affective goals, write with an action verb, get clients commitment. Implementation include the writing, visual and tactile material, select strategy and method, content, sequence, timing, demonstration, discuss, role play, evaluation, has patient learning, goal met, written demo. Counselor assists the guide the patient in solving the problem or making decision, utilize the interpersonal helping relationship. Nurse does not tell patient how to solve problem, guide to patient decision, self-determination, utilize nursing process. Could you just listen? Manager planning, organization, directs, control, delegates. Management process planning, identify the needs, drives, goals. Organization identify the resources to meet goal. Directing leads to other in reaching goal. Control the monitoring, ongoing evaluation. Delegates. Delegation, the 5 rights of delegation: right task, right person, right circumstances, right communication, right feedback. Delegation, nurse who can delegate maintain the accountability. Only the task is delegate, not to accountability. Who can you delegate task to? Manager and leaders, manager administration, relies on controls, short-term plans, high on bottom line. Does think right, leader, innovators, inspire trust. Long-term plan, eye on horizon. Does the right things. Leader, have a vision to energize others, motivate others to achieve the goal, encourage others to do their best, work collaboratively, have wider variety of roles than manager. Leadership skill, cognitive knowledgeable, interpersonal, genius, genuine, inspire trust, ethical, legal, integrity always, communication open, problem solving, critical thinker, out of the box, flexible manager, organizer, self evaluation, reflect, adopt and change. Capacity of great leaders, intelligence, knowledge, judgment, decisiveness, personality, confidence, creativity, adaptability, integrity, independent. Abilities, enlist cooperation, diplomacy, social participation and interpersonal skill. A great leader can't be appointed. Leadership style, autocratic, leader has complete control of group. Democratic, share leadership between leader and group. Lizards, fair, leader give group control. Transformational, charismatic leader create change by empowering group. Situational leader change style to fit situation. Increasing manager and leadership skill, self-assessment, development skill, computer cost, containment, etc. Think positive, maintain physical wellness, psychological strong self-concept, being confident, knowledge, strength and limitation, power. To possess power implies the ability to change the attitude and behaviors of the individual, people and group. Positive power, power with not power over. Type of power, legitimate, reward, coercive, referent, expert. Building power, expert, expand personal resources, rest and reflect, present a powerful picture, dress, act, speak the part, pay the entry fees, stand out, do more, determine the powerful of in organization, know, change the command names, face power, learn the language priorities of organization, learn the mission and vision priorities, increase the professional skill, knowledge, performance, extraordinary, continue in education. Building power, keep a broad view, be flexible, development visibility, a voice in organization, toot your own horn, maintain a sense of humor, empowers other. Changes. Thank you.